Kia koto, my name is Jesse. I'm an anesthetic technician in New Zealand. To continue with the crisis management, today the topic I will mention is called desaturation. So the two previous video I have talking about the hypotension and hypertension. So today, like I said, I will talk about desaturation. So still the same. What are you gonna do first? What is the first thing you have to do when the patient got desaturation, and then the treatment and further investigations. So hopefully you will follow and subscribe my channel. And like I said, like all the emergency card that I use in this video come from my hospital. So one day if you work in New Zealand and you come to New Zealand to work and you come to my hospital, so you will get familiar with all the procedures, all the response to the emergency situations. All right, thank you very much, and then hope you could subscribe and share my channel.
If the people get desaturated, check FiO2 and return to 100% oxygen. Check patient colors, peripheral temperature, nails, and probe positions. Hand ventilate to test circuit integrity, lung compliance. Scan the SpO2 EtCO2 waveform to aid systematic diagnosis. If EtCO2 waveform absence or alters, excludes cardiac arrest, decrease cardiac output, disconnected circuit. Consider laryngospasms or bronchospasms if LMIs convert to ET tube. Check airways positions or patencies. Visualize cord esophageal ET tube. Suction full length of ET tube. Look inside mouth or king or gastric contents. Check ventilator mode and setting. Ventilate via ambu bag to exclude circuits, filter machines problems. If EtCO2 waveforms normal, check fresh gas flow. FiO2 excludes endobronchial ET tube. Inspect neck veins, chest rise, auscultate, use ultrasound. Consider lung breathing curses. Work through diagnostic checklist below to exclude all the other curses. So this is the first response that when the patient get desaturated, and the next things we go for further common causes. Right. So consider timing of events, position change, surgical event, possible causes, airways, endobronchial intubations, airway obstructions, one lung ventilation, laryngospasm, bronchospasms, aspirations, ventilator circuit, probe displacement, malfunction settings, auto beep, low fresh gas flows, oxygen supply failure, circuit obstructions or disconnection, lungs, breathing, apneas, hypoventilations, atelectasis, pneumothorax, sepsis, ARDS, pulmonary edema, contusions, pneumonia, interstitial lung disease, circulation, cardiac arrest, cardiac failure, anaphylaxis, embolisms, pulmonary air, CO2 cement, hypothermia, poor peripheral circulations, metamoglobinemia, brilokine. That is the common, that is the further causes like airways, ventilator, circuit probe, lung breathing, and circulation.
Right, that is the reason people get desaturated. So for me, like if we got a case something people like during like induction, and then patient got like a desaturation or during the surgery. So I normally check from the patient to the machine. So we make sure that the SpO2 is not displacement, okay, and we check make that the tip in the right positions. That normally we get a desaturation. The anesthetist will occultate two lungs, make sure that we ventilate both lungs, and make sure then the tips not kinking or there are not too much like gastric content in the mouth. Then we go to the filter, make sure the filter is intact, not blocked, and then the circuit intact, not blocked, and then we go to the valve, make sure that the valve is floating okay, and then put machine, and then we check the setting and the case. So we go normally in my experience we just go through the patient to the machine, and then we find out what is the causes. So hopefully you can subscribe my channel and share my channel to other friends, and that's what we work in New Zealand. So if something wrong, we take the crisis management card and then we read through it, make sure that we cover everything, and so that we can help to recover the patient. See you in the next video. I try to go through all the like emergency situations, and hopefully you will like my channel, and we see you in the next video.